What to expect as a new nurse? Is it just me? Or do you see new grads getting only 3 weeks in orientation on the unit and then you are on your own? Is it just me? Listen, you better start advocating for yourself as a new grad, okay? As a new nurse on the floor in the hospitals, whether it's a hospital setting, clinic, nursing home, start advocating for yourself. This is your license that you work very hard for. Welcome to Ship It All Registered Nursing, where I support new grads from passing your NCLEX to coaching new or novice nurses to become gritty so you persevere and lead in the field. I am your coach, Janisha Dunkley. Let's shine. Certainly, the day in the life of a new nurse can be both challenging and rewarding. Keep in mind, the specific experience may vary depending on the setting that you're in, right? So, for example, if you started in home care or in the hospital, the clinic, the nursing home, in the hospital also depends on the unit that you're on. However, this is a generalized overview of what you can expect. I am going to walk you through the day in the life of a new nurse. I remember it like yesterday. So let's get started. As a new grad, nurses, you will spend your first week, like the first 2 weeks, you're going to spend that in orientation classroom. Okay, with the nursing educators, they're going to go over skills, the hospital setting, the hospital policies, procedures, including HIPAA. You're going to do lots of modules. For example, workplace violence, active shooter. You're going to do skills like they'll show you brief skills like how to do vitals, how they use their EKG machines. They will go over the finger stick, the glucometer. You'll do the glucometer test. They'll show you what to do, how to do it based on the glucometer that they use, because different hospitals use different ones. So you'll go over the system that they use, whether it's Epic, Allscript. There's a lot of different, so it depends on the hospital. Most hospitals these days, they're using Epic, which is so much easier. I prefer Epic, honestly. I was hired for a stroke/med telefloor, so I had to do a test for both medication, calculation, and cardiac rhythms, along with the medication that you'll give based on the rhythm that the patient is in, like if there's a code, for example, a code blue. So I had to do those tests and I had to pass them. They give you 2 to 3 tries and you have to pass it in order to leave the classroom to now be paired with your mentor and go on the floor. So after that, you will be paired with your nurse mentor, known as a preceptor, on the unit. So this will be like a nurse that's experienced. Honestly, since COVID, before COVID, right, you will have to be like a nurse for 2 years to start training someone to take the class to be a preceptor. But since COVID and the shortage of nurses, sometimes nurses are doing preceptors at like 6 months, 1 year, So when you go on the unit, just try your best to, work hard to get to know everything that you need to know and to develop the necessary skill that you need to perform to your best ability. Be prepared that most times you will be paired with one person, right? And you will have to follow that person's schedule. So just keep your schedule open for at least 3 months. Sometimes they will make little exceptions, but they really want you to follow that person's schedule because that's the person that you'll be assigned to. However, I'm going to tell you again that you need to advocate for yourself, because what if this person that is training you, it just doesn't click? You don't feel like you're learning. You need to speak up. Don't spend all your time training with one person, and because of fear of thinking, oh, I don't want to say anything because you feel like it's gonna look bad or something like that. But listen, this is your license. You need the necessary training, so speak up, advocate for yourself. That is very important. Orientation for me lasted 12 weeks with addition to the 2 weeks that I spent in the classroom. So that was like 14 weeks, but 12 weeks on the floor. And I was offered to take more time if I feel I needed it. Even though the hospital that hired me as a new grad, they were short, the goal was to ensure that new grads got the time they needed, and I truly respect the hospital for giving us that experience, that genuine first start. Now I'm not seeing that happening a lot. I mean, some hospitals still do it, but some hospitals that I see doing that, I think that's a setup for failure for new grads. And if you find yourself in that situation, I highly believe that you should run. For the new nurses going in now, I see some hospitals only giving those 3 weeks. I can't understand that. I can't understand. Oh, you train a nurse for 3 to 4 weeks, and then a new nurse. Some have never had experience in a healthcare setting, so that's an issue. I don't understand that. Okay, so let's start. You go in the morning. There may be a morning meeting / we call it huddle. This can be led by a nurse. Sometimes the head nurse or the unit supervisor may go over the goals for the day and just a overview of what is going on the unit, what is taking place on the unit. For example, if there is a lot of fall risk, central lines, Foley, isolations, it's basically an overview of the unit. Quick reminders telling nurses, remember to check your orders, assess your patients, take bedside report, and if there was an issue, say the day before or anything, they'll go over that, of course. All right, so that's how your morning usually begin. Then it's time for shift handoff / report. So start the day by receiving the report from the outgoing nurse, learning about the patients, their conditions, any changes overnight, and important information that you need to get. They will tell you. You will write it down. Some hospitals, they have like a S-bar that the nurse updates each day, so they'll just pass it on to the new nurse. They'll tell you about the patient at the bedside, and then they'll give you that sheet, and then you'll update it during your shift, pass it on to the night nurse. Okay, some you just write down report. So report is given using a S-bar. That's what I should have told you first also. So the S-bar stands for situation, background, assessment, and recommendation. So it's the same process that I told you before, except I didn't tell you it's taken, the sheet is called a S-bar. All right, recommendation is, for example, plan the procedure. What are we planning to do? What's the plan for this patient? Are they being discharged today? Do they have upcoming tests? Stuff like that. Their assessment when they came in, their background, which is like their history, and situation, like how did they present to the hospital, what really happened. Oh, this person fall at home, they were found on the floor, they were brought in by the EMS, stuff like that. Okay, so bedside handoff is the policy in most hospitals, and I would really advise that you follow the policy and do so. Do not take report at the nurse's station. Go to the patient bedside and see the patient, put your name on the board, start your day, get to know your patient. The nurse give you the report, and that's it. Ask any question that you need to ask. Okay, but some nurses ask 100 questions. That's a joke. Okay, but it's true. Apart from the handoff, I usually print it's called IP medicine. It's in Epic. When you create your patient list, you go to print and you click handoff, and then you can search the type of handoff that you'll want. I use the IP medicine, which gives you a summary of whatever the doctor wrote. Like it's basically like a doctor summary along with the patient status. For example, your code status, their diet, medications that they get in their diagnosis, how the patient presented to the hospital, history, plan. It tells you a lot, and I love that overview. So I usually print that. Even if I get the S-bar, I still print it, because it just basically put the patient in front of you, like you know exactly what is going on. You should also go in, check your orders, and read your doctor's notes. Okay, so assessment. So you're going to conduct patient assessment, checking vital signs, ensuring that all patients are stable, Usually the CNA or the tech will do the vitals. However, you are still checking vitals and following up on vitals, because so, especially for example, if you're going to give a blood pressure medication or anything that you know may affect the patient blood pressure, you should be checking. You should be following up on their blood pressure. If your CNA did a blood pressure, they said it was high, you should also follow up with a blood pressure audit rate. Always follow up with patient vitals. Always follow up with their blood sugar. If they're on insulin, make sure you're checking those. Okay, so then it's time to administer your medication. So you administer medication that the doctor prescribed. You'll pull it up, you'll see what you're getting, you'll go to the Pyxis, you'll get your medication. So ensure accuracy and adhering to the proper procedure for each medication. Okay, most time your medications are scheduled, your morning meds at like 10 a.m. Those are like the big med pass. However, you may have 7 a.m., 8 a.m., or 7:30, 8. You hardly ever see 9. So for like blood sugars, there are some popular ones that are usually due early. For example, blood sugar, your insulins, because you're doing blood sugar early in the morning. Sometimes the nurse before you will get it done. Breakfast sometimes comes at like around 8. So you're checking your blood sugar, or the CNA may check your blood sugar. You see what it is. If it's too high, you're going to follow up on that same time. Most time the insulin is due at like 8 o'clock. So you'll give it then right before they eat, say 15 minutes, because aspart is a fast acting medication, so you can't give it if the patient didn't receive their breakfast. And sometimes, even though breakfast is supposed to arrive at 8, it may come at 9. So don't give insulin unless most times when I give it is when I see the cards are known, the unit they're going to give it out as. Okay, I'll give my patient their insulin at that time. You have levothyroxine, that's usually due early also. You have that's usually due at like 7 to 7:30. You also have the silvalimerd that they're supposed to take when they're going to eat their meal. So it depends on the patient and their diagnosis and the medication that they need. Sometimes medication are due before 10 o'clock. Okay, next, collaborating and interacting with other healthcare teams. So you're going to do a lot of that junior shift, such as the doctors, pharmacists, therapists, for example, occupational therapists, physical therapists, families. You're going to interact with a lot of families. Sometimes they will call asking you, can you give me an update? Ensure that you're speaking to the correct person because of HIPAA, and also depending on questions that are being asked, it may not be in your scope of practice. Let's say it's midday. Patient care, you're going to provide a lot of patient care. Whether you're helping your nursing assistant, you're going to provide ongoing care to patients throughout the day. This starts early in the morning, because sometimes you have to start doing that earlier in the morning. Okay, including assisting with daily activities, monitoring symptoms, and addressing any concerns. So you're interacting with your patient hourly. So you're interacting with your patient all day, right? Providing the necessary care and addressing any concern. Okay, documentation. Document on all patients. You are going to do a lot of documentation through your shift. So usually some nurses start after they assess their patient, right before they give medication. If there's anything that you need to document, you can start documenting at that time. Once you have assessed your patient, that's the time when you can begin documentation. Okay, and you're documenting any changes in their condition in the electronic health record. Okay, so documentation, document your education that you have given to them, whatever assessment. So there's a lot of documentation. So documentation education is done in the classroom first, but you will learn it better during your weeks of orientation with your preceptor. They will be able to show you how to navigate the system even further in depth, and where we really need to document and what we really need to document. Okay, Educate patients and their families about health concerns. Be sure to take a break and recharge. Eat something, drink some water, have some tea, hydrate yourself, or some coffee if that's what you like. Okay, use the bathroom, do something for yourself in the afternoon. Okay, take a little break, a 15 minutes or 30 minutes. For a 12-hour shift, you are allowed 30 minutes break before your hour or after. So it depends on what you want to. If you want to take your lunch break, once all your patients are stable, you give all your medications, and you get another nurse to break you, take a break. If your preceptor is one that doesn't take break, ask them. Say, I would like to take a little 15-minute break. Okay? You're gonna be having meetings. Sometimes there will be a second meeting. So say in the evening time, maybe 3-4. Sometimes some nursing supervisors, they will do a little follow-up meeting. If anything took place on the unit, they may do a little follow-up meeting. Okay, so lots of meetings. Be prepared to respond to any emergency. This is a very unpredictable job, so recharge when you can. That's why I tell you to recharge when you can during your shift, because this is a very unpredictable job, and sometimes emergency happens. You have codes, so also it is busy at times. Sometimes your patient have MRI, they have CT scan, they have like procedures to go to, say a colonoscopy, they have to go get a peg tube. There is a lot of things that can go on during your shift, so time management is essential throughout the day. There may be new orders, there may be orders that have been discontinued, so constantly checking and refreshing to see your orders pop up. That is very important. New orders the physician put in, for example, it may be a lab specimen, blood draws, Foley discontinued, they need a bladder scan. Depending on the patient output, they need a stat EKG. Some patients get methadone, so they want to see their QTC level. So there's a lot of things that go on during the day, so refresh and check your orders constantly through the day, so you don't miss up on anything, because you don't want, when it's time for you to go home, that's when you're seeing an order, you're like, oh my god, that order was from 3 o'clock, I know 7 o'clock order was, and you didn't do it, you didn't acknowledge that order. Okay, so in the evening time, you're doing your frequent rounding, your frequent hourly rounding, checking on your patient, performing your rounds, patient care, ensure your patient is good, they have everything they need, their table is beside them, they have their glasses, stuff that will allow their safety. Because when you're round and you check on your patient, you're ensuring that they have everything that they need, so they don't try to reach for anything or try to get up and then it cause a fall. Okay, so in the evening time now, you're going to give medication again. Sometime in the afternoon, you have 12 o'clock, sometimes you have 12 o'clocks, you have 2 o'clock, you have 5 o'clock meds or 6 o'clock meds. So remember that medication can be given an hour before and an hour after, depending on the medication. So for insulin, they're going to schedule it for 12 o'clock or 11 o'clock again. So you're giving that before the patient eats, correct? So for example, if say you have the doctor order a antibiotic and it's due at 2, but you have something that was scheduled at 1, you can give the 1, and then by 1:30 you give the antibiotic. It's fine. If there are specifications on the medication, sometimes they'll put it in on the MAR, and sometimes if you scan a medication and you cannot give it earlier, it won't go through. Okay, so be sure to cluster care, because if you're running every time something is placed or a medication is due at 12 and 1, if you can pair the 12 and 1, pair them, because that's how you do cluster care, because you don't want to keep running back and forth. It's gonna burn you out, like complete burnout. Okay, so you did all of that, you did your medication, you took care of your patients, and now it's the end of the shift, and we're going to give a beautiful end off. Okay, so you're going to provide detailed report to the incoming nurse, ensuring a smooth transition. Sometimes it's a give. I love it. It's a give back. Love when the nurse already know about the patient. It's a smoother transition. But if the nurse doesn't know about the patient, ensure to give them the necessary information, the background. Follow the S bar, right? Your situation, your background, your assessment, and the recommendation. What is the plan for this patient? Nurses love to hear the plan for the patient. So ensure you know the plan of care. Know the plan. What are we doing with this patient? Okay? So now it's time to reflect on your day. Okay, reflect on the events, reflect on what you have learned, and embrace your challenges. As a new grad, you're going to have challenges. It's going to happen. And be prepared to be criticized, you know. Remember, most times the challenges is critical thinking, learning how to prioritize your tasks. So reflect and learn from it. Learn from every experience. So balancing multiple responsibilities and prioritizing tasks, dealing with stressful situations, emergency, for example, the rapid response, the cold blue, those are what throw off a lot of new grads, because you have to stop what you're doing and now attend to this emergency. So adapting to the fast pace and the dynamics of the nature of the healthcare in the hospital, in which are the hospital or whatever setting that you're working, that is what affects a lot of new nurses. So time management is essential. Okay, so it is a rewarding job, but it can be hectic, especially when you're just beginning and if you have no healthcare experience. So continue to build and to grow daily, making the connections with your patients and your family, making a positive impact on your patient's outcome. Okay, so if you find this video helpful, remember to like, subscribe, and share the video. Okay, subscribe to Shibidol Registered Nursing. We're here to help. Bye.